I think it's really important in shaping the future of local government, creating a more sort of cooperative and collaborative model where the views of the communities and people are incorporated into policy, but also into the service delivery. Again, as I mentioned previously, it provides a space for councils and partners to work together to sort of learn, share, and develop innovative approaches to meeting community need and delivering services using cooperative principles, which I'm an advocate for. For example, just trying to think, sort of bring it to life a little bit, this year CCI are funding 20 health and social care policy prototypes, which are small pieces of work developed by councils. But there's 20 different initiatives there, which are sort of testing and developing new ways that care can be delivered to support vulnerable individuals and their families. So I think that sort of shows that in this 1 year, there's 20 different pilots that are sort of testing, which hopefully will make a fundamental impact for the better on individuals' lives. So that's just one example of what CCIN is doing. I think as well, just on a more sort of a holistic scale, CCIN is sort of a powerful voice and provides credible evidence to shape national policy for better and improved local government. So there's tons of really important work that they're doing, and we're just grateful to be part of that, really. I think probably some of that, again, I touched on in the above question, but again, we work only in the public sector, and this is our world. So local government is our world, really. Most of our team have come from the public sector, mostly local government, and have hands-on experience of delivering and managing these local government services. For example, we've got qualified social workers in our social work team. We've got people who run facilities management services, doing RFM projects. So I think that gives us a credibility and an empathy that perhaps some other private sector organisations consulting into the local government world don't have. We see ourselves as sort of by local government, for local government in a way, even though we are a private business. I think probably most importantly, in this regard, we very much focus on maximising sort of social outcomes and social value and supporting the long-term sustainability of the sector. So although there's a lot of financial challenges that the sector is facing at the minute with reducing budgets and increasing demand across the whole country, which presents a ton of challenges, we don't believe that there should be a slash and burn type approach. We're much focused on doing things differently, changing the way that services are delivered. We focus on investing in areas such as prevention and intervention, better using data and technology to deliver more effective and targeted services, and to work to reduce demand in a sort of safe and controlled way. We're very much focused on the same as CCIM, working more collaboratively and closely with the community and building that community resilience. And training and upskilling staff as well is critical. For example, again, in social work, we sort of run training programs where we embed a strength-based approach to social work, which has seen not only outcome improvement, but also cost reduction. So there is different ways of doing stuff, and that's what we sort of focus on. I think that probably that social value element is key in our organisation's approach. And it's absolutely critical in all of our projects, both when we're designing solutions with the council team internally, but also engaging externally with partner organisations and also stakeholders and service users who are actually in receipt of the service from the council. It's critical to sort of incorporate their views and experiences, and often they'll know the issues, challenges and opportunities better than what you do. And that's, again, absolutely critical in our approach. It's doing things with people rather than to them is key in our culture. A lot of the work that we do is actually in social care, adults and children's services, where co-production is actually part of the Care Act legislation, so it's a requirement to sort of engage, which is great, which we're very much advocates of. So, for example, here we'll typically engage with service users and their families to co-produce improved pathways of care, or to co-produce different ways in which technology solutions can be utilised. I guess the key aim often is, whether it's social care or wider, is to improve the experience of individuals and ensure they get the support that they need at the right time and in the right level, at the right place. So I think co-production is critical because you're involving the views of those service users, and we couple it with the sort of local context and understanding of the council teams and the partners with our sort of national best practice that we've learned from working across over 100 councils. That co-productive approach ensures that you arrive at the best and most innovative solution. I think it's also very important to sort of test these solutions and to sort of allow challenge from stakeholders once you think you've developed them. So it's sort of a moving goalpost, but I think that's important to sort of keep co-producing them. So yeah, it's pretty much essential across whatever project that we work on, but very much so in social care too. We believe it's completely critical to give service users an active voice in influencing that policy and that service redesign, and make sure that I guess it's a genuine partnership with local authorities and local communities. So yeah, co-production is absolutely key. So we specifically work within local government and health, which means that we've got a comprehensive and detailed understanding of the services that are delivered. We sort of badge ourselves as sort of practitioners or experts within, social care or waste, transport, facilities management, whatever it is, because we only work in those local government and health services. So that's one element. I think as well, we're very much focused on sort of collaborative working and cooperative working, so working jointly with council teams. Unlike some of the bigger organisations, we only ever put a couple of our core people in amongst the council team to work alongside internal teams. We design and deliver the service transformation collaboratively to co-produce solutions. There's a number of benefits, I think, to this. So not only do you get the best solution because you've got input from the local teams who understand the local context and local demographics, which is completely invaluable, it also sort of promotes co-ownership. So we own the project jointly with the council, and it means that, first of all, the chances of successful implementation of the change are higher. But further to that, it means that if we leave the project, they still drive it forward themselves because they sort of own it. And building, I guess, the other elements of that would be that there's a lot of upskilling that goes on. So it's sort of related to but separate. We sort of focus very much on coaching, mentoring, and upskilling staff. So through that collaborative working, but also through more formal coaching methodologies, because some of our teams are qualified coaches, which we try and train, upskill staff so that we leave a bit of a sort of legacy of sustainability, which ensures the project's success really, and also equips the council with a better workforce for future. What else is different about the way we do things? I think, we're very much focused on implementation. So we don't just do service redesign and leave the sort of report with the council to do itself. We're very much focused on implementing those recommendations, and that's actually the majority of our work. So we're accountable for realising the associated benefits of our transformation programme, whether it's quality improvement, social improvement, financial improvements, or often all of these things. So I think fundamental to that is that the recommendations we produce have to be realistic and achievable, because we are going to be the ones delivering these, or we hope we're going to be the ones delivering these with the council.